Hi everyone, I'm Dr. Steve Lakomy. I'm an full-time emergency physician at Mount St. Mary's Hospital in Lewiston. I got interested in this subject. We often see cancer patients come in the middle of the night. They're at wit's end, they're nauseous, they're vomiting, they can't eat, they can't drink, they're dehydrated. They're taking medicine for these conditions, but the medicine's not working, and so they come in for help, and of course it's very frustrating. You want to do something for these patients, but you really just run out of all the ammunition that there is presently. So that's how I got interested. Many times I would even say it's unfortunate that we don't have medical marijuana for you, because it certainly is worth a shot. And the benefit would far outweigh any risk. So that's how I got interested. But it's not just for cancer patients who are nauseous and who can't eat and who are losing weight. There's lots of evidence, more now. There's been research on marijuana for many years, but there has not been a lot. It's an illegal substance. It's been very difficult to do research because of that. But in the last few years, there are many, many, many studies, and those studies are showing very good results for certain conditions. Cancer is one of them, and it has already been mentioned. Certain seizure conditions, HIV/AIDS, it helps reduces pain and spasticity, which is like spasm in the muscles, which is very common in people who are suffering AIDS. It also alleviates bladder spasm in those patients. There's good results in patients with multiple sclerosis who also suffer a lot of muscle spasm, and again, marijuana appears to be helping according to these studies. So that's would be very helpful for those patients. Again, that's another chronic condition that there is no cure for. Marijuana is not necessarily a good medicine for acute pain, but people who suffer chronic pain or certain chronic pain conditions, there is evidence that marijuana would be helpful for people who are suffering chronic pain. There's also research for people with irritable bowel, which is like a spasmodic bowel condition that's quite common. It helps reduce those symptoms. So there is more and more research that is showing that marijuana can be helpful for several medical conditions affecting a lot of people. Now, as far as the safety is concerned, there's a lot of misinformation out there. The most common things you're going to hear is it's highly addictive, it's very dangerous, it causes brain damage. Well, really none of this is true. What is true is that marijuana is quite safe. There is really no known death from an overdose of marijuana. It's extremely safe that way. It is an addictive substance, yes, but it is very weakly addictive. Tobacco, alcohol, and narcotics are far more addictive than marijuana. The statistics are showing maybe 9% of people who smoke marijuana might become addicted to it. If they do, and they stop taking it, the withdrawal, which can happen, let's say, with alcohol and narcotics, it's very, very weak with withdrawal symptoms. So it's not a very strongly addictive, addictive medication, although the potential is certainly there. But it's there for the narcotic medicines, which we use lots of, as you all know from reading in the newspaper what's going on with narcotics. They're very useful, but they can be abused. The other bit of misinformation you'll hear is it's the gateway drug. In other words, you smoke marijuana, the next thing you're going to want to do is shoot up heroin. Well, there's really no evidence that this is true. Yes, if someone wants to smoke marijuana right now, you have to go to a drug pusher, and maybe that pusher might try to sell you something else. So it may be a gateway in current conditions where you have to buy it illegally. And also, probably a lot of people who are addicted to very dangerous substances, cocaine and narcotics, probably at some point smoked marijuana. So some people draw the link, well, they smoked marijuana, therefore they got hooked on narcotics because they smoked marijuana. But again, there's no evidence that it is a gateway to anything more dangerous. And I'll be happy to answer your questions afterward. Thank you.